assist the province. Resources have now also been directed to the province, which has 417 infections and 6 deaths. The provincial government and other stakeholders just concluded a meeting to update on the latest interventions. Let's go to a briefing now and get a sense of what's come out of that meeting.
Talk about Port St. John's, whether you talk about Nelson Mandela Bay, whether you talk about prison here in Buffalo City, East London, in ensuring that we screen and test everyone. We're doing that in Christiani, Lady Frey, rural areas, as this COVID-19 is showing its ugly head in almost every corner of our province. We are seeing it almost every day now throughout our geospread. Even in regions where we probably had no positive cases, now we do have positive cases. So the province is just annexed now by COVID-19. We are working very hard as a province, following the strategy, which is a global strategy, which has been nationalized across all number of countries. We have adapted the national strategy into our own provincial material conditions, and that's the results of what we are seeing, and we are really looking for this virus for us to be able to flatten the curve. All what we have seen, it is as a result of work that we have been doing since the day one doing it. Of course, it's not a work that is just happening without challenges. We have been coming across a lot of challenges, sometimes from our social partners. If you look at the challenges of labor with PPE, almost every challenge that we come across, we attend to it. Even to date, we still commit ourselves. Yes, the issue of PPE, it's a global challenge in terms of supply, while the demand is very high, but we are doing everything possible to ensure that every frontline professional or employees, general, including general workers in our healthcare facilities, are safe and are protected. We don't want to have any employee who must be vulnerable to this. We need them healthy more than ever before. So that's the kind of work that we're doing. The team from National made a presentation. When we welcomed or received them with the minister here, we indicated that they will have to go through our strategy as a province and see what can be done to put more impetus on the work that we're doing, and indeed they've done that. They've revisited a number of sites, including the prison, in looking at how we have been actually dealing with these matters. Their plan will neatly dovetail into our provincial plan that we have been working, because the provincial plan is actually derived from the national plan. So we've got to work together in that way in this country to ensure that we attack this virus. So that's the kind of work. I'm quite impressed with the presentation and the plan that they've presented. They've been well received, warmly welcomed by our teams on the ground. As you understand that we have got our teams, screening teams, testing teams, and tracing teams all over the province as we speak. We have got not less than 35 people per team, per district. That's why we are able to get into any corner immediately. We've got an indication of a positive case in whatever corner, rural or urban, in this province. So some good work has been done and led by MEC, not sleeping, working 24/7, throwing herself into difficult situations. And of course, it's not an easy thing, as we all understand that we are really dealing with a global phenomenon. And we are also seeing some phenomenal experiences in the process. So we are learning every day, we are correcting, we are improving. From where I'm seated as a premier of this province, I'm quite the work that was the challenges. Yes, of course, there are teething challenges in the system, and how you repurpose government and how you inculcate a new culture. This came at a point when we were working on that in preparation of our 6th administration, to really inculcate a new culture, to ensure that government employees understand that we are here to serve our people. We are on this program to save lives. So our preoccupation is about saving lives. We also experiencing some challenges. We are seeing elements of stigma creeping in certain corners of the province, and also other people resisting the quarantining and isolation, especially those who are in rural areas, for a number of reasons that they are making. But we are actually putting our foot down, because if we identify you and you cannot self-isolate at home, you cannot be easily quarantined at home, we are forced as government to act on that, and we have been acting decisively in those areas. Some are still running around in terms of tracing, as it is also difficult to get all the contacts, especially in the rural areas. We are using every system at our disposal to get into that, but we have always been above 90% in tracing the contacts of those who have tested positive. So the system is maturing, and we are trying to get the entire ecosystem working in a much more seamless and well synchronized approach, and everyone understanding that this war that we are in needs a lot of selflessness, needs a lot of sacrifice, needs patriots. And so we're calling everyone to join us. And yes, of course, we're still experiencing a lot of challenges with regard to compliance with the regulations. You see scenes that we should not be seeing, but unfortunately regulations are flexible enough to allow people to always visit our towns, especially in the rural areas, because they are looking for food and they can only get food in those small towns. So that remains our challenge, just like funerals. We've been on this campaign for a number of weeks now, since we started calling our people to really exercise restraints, to really take extra caution, particularly around funerals, really appealing to our people across the divide to really take heed of our call that we must change our socio-cultural approach on these issues, and we must also deal with the behavioral patterns, because the challenge that we have out there are people who seem not to be taking serious what we are confronted with. We're still making that appeal. We're still seeing long queues of people queuing in the shopping malls and looking for food. And we are telling people that this virus is going to wipe us out if we don't take this virus serious. So our call out there to everyone in our villages, in our communities, in our townships, is that government is out there doing everything possible in our power to protect them, to save lives. They must make our lives easy. Many people are calling for police, many people are calling for soldiers to come in. We don't have to. We don't have to. Police can just come to keep peace, maintain, enforce law and order. But ourselves, adults, must be adult enough to also look after themselves and their families and their children, to make government work a little bit easy. So today we have done a good job that we normally do as a province. We meet weekly in our provincial command council. We are meeting tomorrow at 2. every week, that is Sundays, and every week on Mondays, 3 premier briefs, all political parties in this province who are represented in our legislature. So we are putting everyone on board, all critical stakeholders. This week, I will also be talking to a religious community. I've been approached to do that as well. We are briefing traditional leaders on an ongoing basis. We will also be reaching out to labor as a critical stakeholder so that where there are probably elements of divergent views on the issues of PPE, we can really find those. In the last interaction we had, we agreed that let's have a joint monitoring mechanism, because employees where they are and their representatives must be able to pick up those issues and indicate. We do have the minimum stock that can take us for some time. We have ordered a lot of stock to come through. As we speak, deliveries are being made. In Nelson Mandela yesterday, the field hospital in the Nelson Mandela Bay Stadium was also handed over to us as a department. We do have those, and we are working on the field hospital that has been donated by Volkswagen South Africa. We're going to be establishing a couple of field hospitals across the province because we need about 8,000 beds to accommodate the number that we are anticipating, as this problem it will be with us for some time. We are still at the embryonic stages. We're still getting to a more serious situation as time goes by. So we have our teams in place, and we might not be perfect, but we are perfecting the system every day. As I've indicated, that every day we learn 1 or 2 things on how we are dealing with issues. But I'm quite happy with the work that has been covered. If you look at the ground that has been covered, screening about 450,000 within a short space of time, testing about 8,000 people. And in that, we have got numbers. The reason that our numbers are growing up every day is simply because that is a response to our plan. Our plan is to go out and look for this virus and stop it, contain it, so that it doesn't continuously infect other people. So we are using our public facilities. We're looking at all our protected areas as additional beds to the quarantine sites and isolation sites over and above what we have in our hospitals. We are decanting our hospitals to ensure that we open up beds to allow people to be in that space so that they can also be well monitored and for ongoing observations. We are actually triaging people as they come into hospitals. We're putting up facilities because we want to really insulate hospitals from any further infections, to protect those who are in the hospitals, be it patients or professionals, doctors and nurses and workers in general. So whoever comes through an hospital, at least that person must be screened. And next to our triage centers, we've got processing centers for those who might be viewed to be candidates for further investigation. So any people under investigation are also well taken care of. So we are working on that to ensure that every person that we identified, we test, we quarantine those people while they are waiting for their results so that they don't keep on spreading the virus. Where we have tested people positive, we isolate them, we provide those facilities as government. So Public Works is working on that on daily basis. Health is able to identify all such cases and then make a demand to public. That's how we work. So as a premier, I think I'm doing my overall job. I know this is a really litmus test for every one of us. We are expected to lead under very, very difficult situations. All what has happened thus far, it is as a result of the calls that we have made. We really appreciate the intervention that the minister has made to the province, as he did in other provinces that had such a number of cases before us. We have made that indication as a province that they would love National to come closer, strengthen our teams, our tracing teams, all these epidemiologists that we're talking about, virologists, microbiologists, all of them, those specialists that are here are part of this team that we're talking about. So we've got a full force that is really hitting the ground running. I'm quite impressed, I'm quite happy, and then the team is gelling nicely. The team is gelling nicely, and they can also speak for themselves. So we are very clear. We're trying to perfect the system. We are meticulous, we are clinical as we move along, and ensuring that our people are protected. But our people must protect themselves. We're not going to stop this virus if our people are still waking up and go to town for things that they don't know. We know some who are looking for food, etc. We can't do anything about it, but we are really appealing to our people that resist any temptation that makes you to move out of your house. Stay in your house, protect your family, protect your kids, your grandchildren, make sure that your kids are there. We have actually suspended every games. We can't even see kids playing on the streets. It's not allowed. They should not be. They can't be not playing on the streets. So we want people to take this thing serious. So the government or state capacity is stretched to the limit. If you would want police to chase people around for funerals. This morning I was woke up in the morning and told that there's a funeral in Tsolo. People are riding horses, huge entourage. Those eventful things in funerals. And we said police must stop that. We have said 50. Even the 50 is not scientific. We have said so. People can still spread the virus within that 50. Yes, the 50 will help us because it will be a limited number to trace. But we don't want people to be in that space. That's why I was saying those patients, those actually, people must be immediately buried when we come across that situation so that we don't have any further exposure on this. The numbers that are in Western Cape, without doubt, the more numbers in Western Cape grow, the more we are worried in Eastern Cape. Some of those people who die in Western Cape because of coronavirus, they are buried here. So we are dealing with that kind of a situation every day. We're quite happy that we've managed to control the traffic on our R61 Aberdeen. The traffic has actually subsided. As you know that every weekend you've got all those long queues of taxis bringing the bodies here for burial, etc. So our law enforcement is trying its level best. We are reinforcing, and soldiers are being reinforced. More teams are being brought up, and we've also asked for further capacitation, looking for also more capacity from the military. That includes their medical capacity to ensure that we really broaden the state capacity to handle this issue. So we are looking at every possible aspect and also appreciating donations that have been made. We've seen people distributing food. We really appreciate that, but also want to caution that people must not exploit our people as well in the process of doing that. We want those decent food parcels to be really decent. In other areas, you can see an element of our people being dehumanized because they are hungry. Even those who are messing up, undermining what government is doing, with those food parcel SRD programs, we're pushing back the frontiers of poverty. We've been doing that. That's why we've got a social security grant in this country. So that is done to help our people really deal with issues of high levels of poverty in the province. You would understand the Eastern Cape is a province that almost all the factors that really get the situation exacerbated on COVID-19 are here. If you talk about old age, you find those people here in the province. If you talk about the levels of poverty, the high levels of unemployment and underdevelopment, So, of course, it will be extremely catastrophic in our province. This, if it cannot be contained, we still need more. We are working with universities. Universities are putting together their also specialist teams. All our universities here, the Nelson Mandela University, Rhodes, University of Fort Hare, as well as WUSU. All of them, they do have science faculties. They've got a role to play. I've had a discussion with the vice chancellors. They are putting together those teams to strengthen the team from national and our provincial teams that have been working on the ground. So I'm quite optimistic, and I really believe that we are going to overcome this. We're going to prevail, and government needs support, and everyone, leaders need support, our professionals, our employees in general. We need dedication. We need to redouble our effort to make sure that we save lives, we save our country, we save our people on this. But our people must start taking things serious, must be responsible about themselves. So those who still think that it's an opportunity to play politics, hard luck to them. We are not in a space of playing politics. We have got the enemy, and the enemy is clear, though it is invisible, but we are targeting, we are going for it. So we are really appealing to everyone that this is time to unite, this is time to pledge solidarity. We don't have time to play politics now. We've got time to ensure that we actually throw every energy you have into this. So all those who have got energies to do that would want to see them volunteering on the ground to save people's lives, more than howling and insulting other people as they are doing their work. Government won't be distracted in this province. As we see us here working, and we are working every day. We don't have Monday, we don't have Sunday, we don't have Saturday. We are really committed onto this. We are really committed to serve our people, understanding, of course, that we are servants of our people. So that's the kind of work that you see us doing, and doing it every day. So I'm quite happy with the kind of support that we've been getting from a number of social partners. We're still calling the business to continue donating. We need more masks. We need all the PPE, the basic ones, so our people together. We want also to lastly appeal to our professionals. We have observed high level of anxiety and fear. We still want fearless people. We want revolutionaries. That's a time that we are looking for such patriots. So the kind of anxiety that paralyzes even our professionals is worrying. So we have trained here in the province not less than 4,000 health professionals. So they have been trained on COVID-19. So it's important that we work together on that. And we are also looking on calling even the retired nurses out there who can come in and help and advise where possible in ensuring that we are able to deal with this. Of course, knowing that these are old people and we want to protect old people, knowing that they are the most vulnerable to be attacked by this virus. But we think that their inputs will be most welcomed and will be most valuable, and with all doctors. We are working with the private sector to ensure that all of us, we are able to contain this and disrupt the transmission of this virus. So I think that's a long and a short of what I can say with regard to the work that we have been doing since morning. And I had a meeting earlier with the head of department and MEC where we were looking at certain issues and putting everything under microscopic view. Now we're going back more energized with our systems being more lubricated. So we would want to really invite everyone to ensure that people are supported, leadership is actually available with all our programs that we have set up. Clear our systems from the national or presidential command council to provincial command council, going to district. In the province, we have taken it down to local. We've got a local command council, and we have taken it down to ward, where we are establishing a ward council, actually resuscitating our Operation Maspatisane as a province, the war room, because everyone must be activated. Our ward committees, our traditional institutions, so that we protect people from there for them not to go to town, and we discourage them so that we don't have police to deal with people in town when they are leaving their communities. So our people must be engaged at that level so that people don't prepare events, don't prepare funerals and get police coming in to disrupt funerals. We should not be doing those things. We are really discouraging those funerals. Our attitude as a province was that we should have suspended funerals, at least for some time. That's our attitude. But the national guidelines are still flexible on that. But people must comply fully with the national guidelines. And if they don't, we are enforcing them. So that's our attitude at this point in time. We really don't want to get people into all this. And people must know that they are risking and exposing themselves for not complying. These regulations are meant to protect them, and they must respect them. They must cooperate and ensure that everyone is safe in our province. So that's a long and short from me. I think Dr. Kathy, you can probably make a reflection as well. The SG, then the MEC will be the last. The government of Eastern Cape is hard at work, is functioning properly. The Department of Health is working. It has got leadership in place, and we are supporting the Department of Health and doing everything that that department succeeds.
So thank you, Premier. On behalf of our team, we'd like to express thanks to you and to the MEC and to Dr. Mbengashe for your welcome of us today and over the last 3 days. We were requested by the Minister of Health, the Honourable Dr. Zweli Mkhize, to come alongside the province to support them in their fight against COVID. We were introduced on Tuesday, and we have spent the last 3 days meeting with people, doing site visits, understanding the systems and how they work, and identifying what has been done already and what areas this team can focus on. The team is primarily a team of epidemiologists and data managers whose primary strength is to support and help where it comes to the identification of cases, contact tracing, and the data management that arises as a result of those data elements. We have successfully identified a number of areas where we can come alongside and provide support. Our task over the next 2 to 4 weeks will be to work alongside the department in these specific areas. Many of the areas are in fact common to any administration as they seek to strengthen their approach to an outbreak of this nature. And the province is not alone in finding particular aspects of managing this outbreak challenging. We are leading the world in the way we have curtailed this outbreak. And I've no doubt that the contribution of the Eastern Cape Department of Health will support our national responses to the outbreak. The 5 areas that we will be provide strengthening in include a support for strengthening the data pertaining to the essential COVID-19 data set, to support data management pertaining to contact tracing, to strengthen the quality of hospitalization and death data, to support directed community screening in Buffalo City Metro and in the Nelson Mandela Bay metropolitan areas, and lastly to support the rational and accountable procurement and use of PPEs. So these elements are already fully covered in the Eastern Cape Provincial Department of Health plan, Our contribution will be to strengthen those areas and build on the existing systems so as to leave a legacy behind us that will enable the province to comprehensively report on and monitor cases of COVID disease as they occur. With that, I'd like to hand over to my colleagues.
Thank you, Honourable Premier and the MEC. I think we really welcome both the Minister and the Premier's support. Our major focus is to ensure that we've built the capacities to test, screen, and isolate patients. And we want to make sure that when we release the lockdown, we've got all the capacity that we require. We've been focusing on 4 major capacities. The conventional capacities to make sure that we continue to provide healthcare services and separate our hospitals from patients with COVID positive. We've built a lot of contingencies to make sure that if we are faced with cases of COVID in most remote areas, we actually have the capacity to do so. Most of the work that's been done on the PPE, building up of field hospitals and making sure and repurposing many other hospitals, is to make sure that we will be able to respond to the surge of more patients to our services. And we want to make sure that we are not found wanting in those areas. And I think this is really one of the major contributions from both the Minister, the team from National, and our own local team. The department works and supported by the JOC, and that has been extremely useful to make sure that our work is supported and we're able to achieve what we need to do. Thank you, Premier.
Thank you.
Good afternoon, all. Well, I do believe that a lot has been said. However, it becomes critical that as a province we start to talk to our people in terms of what then becomes their responsibility in terms of what has been said. Because all efforts by both the Minister and the Premier and the team that's here will be found wanting if we are not sticking to them. One of the issues that's coming to us strongly that I feel I must address is the issue of hospital and patient visits in our hospitals. We've taken a decision to actually deal with that. We've curtailed the free and all the times in hospitals, that we have reduced them to 1, and even 1 visit is too long. It has just taken to be 15 minutes. And we're appealing to our people not to bring in prepared food, but rather sealed issues to hospitals. And that becomes a very sensitive issue. The second one is the whole issue of starting to talk to our people to say, can we treat all deaths that are currently happening now as COVID positive deaths, so that we try and minimize this issue of many people coming to an area. I know, precisely because the Premier has touched on the issue of the stigmatization, people might want to believe that people are all COVID positive. However, it is not because of that, but it is a matter that we say if we continue to allow our people to slaughter cows and sheep in the areas, most people will always come to the funerals. And as we talk to these issues, we have also actually spoken to our own people, and our facilities now are providing treatments for our chronic patients 2 months in advance, so that our people don't go frequently to hospitals. And that, to a certain extent, is another way of ensuring that our old people are not always exposed to what is happening. Classes jonga gezi zinto. Kubalekile kubantu bakuthi sizithethe. Ngoba abantu bakuthi abakayiqondi ubunzulu bokubaluleka kokusigcina emakhaya. Okulandelayo bayalwa besivelwe ngabanye izolo esibhedlela besithi sobona abantu bethu sicela ukungeniswa. Okwesibini, abantu bakuthi kukho lanto okuthiwa elective operations or surgery operations or processes. Sithethile Premier sathi abantu bakuthi ezo noko ezingababulaliyo kufuneka bayamkele ukuba ngoku azizizo ezikuxanduva lokuba sibe zizoqala. Okwesibini, bonke abantu bethu abasezibhedlele kuthi ngoku abastable siyazama ukuba sibagodisele emakhaya ukwenzela bakwazi uvuleka ispace ezibhedini. Xa silijonga ke iphondo lethu lifikelwe ngokubana iCovid ingene ezilalini. Once ingene ezilalini ke ngoku sisengxakini because ezilalini kuvele kungakwazeki kwizibhedlele zethu ezilalini ukuvula ispace kakhulu. Kodwa ke siyazama iphondo ukubana sifuduse izigulane sizise kwezinye ukwenza basivule ezinye. In all those efforts then, it is actually us starting to say, can we flatten the curve so that as the curve flattens in terms of high numbers, we are then able to contain those numbers that then will not be as high as we have now, because high numbers are becoming increasingly difficult to take into our facilities. However, if we can control the surge and we get even in terms of normal numbers as we go along, because we all agree we're not going to actually kill COVID immediately, but the numbers must be such that our hospitals can afford to take them, and we're able therefore to treat those that need treatment, but equally isolate those that need isolation. Premier, I want to believe we've done it. Thank you very much.
Thank you. The first question. Okay, cheers. Amen.
Thanks. My name is Songada from News North Cap. I have a number of questions, but for now, and in fairness, I'll start with 3. You mentioned that in terms of the plans that the province has, you are planning to have a capacity of 8,000 beds, because that's what you anticipate you will require when the rates of infection peak. Could you please share with us, in terms of your projections, when do you expect that to happen? That is the peaking of the infections. Secondly, Premier, we understand and we heard that the Minister of Health was particularly unhappy about the data relating to the number of infections in the province. Can you please tell us what have you done in that regard to remedy that, and also perhaps your response to that? And lastly, the issue of rural areas, we're talking about the difficulty in terms of getting people to agree to being quarantined, particularly in rural areas. And we read this morning a story about 40 people coming out of Majola that have tested positive for COVID-19. Can you tell us where are all these people? Have they been quarantined, or are they still where they are? You're struggling to get them into quarantine centers. If you do have some in quarantine centers, what is the ratio? Thank you.
Okay. Cheers.
Okay. Thank you so much. I'm Stan Webela from Isolezola's Kosa newspaper. To Bungalwa's question, in fact, I wanted to ask a similar question. Can I please ask Premier if the current number of beds, because you are saying about 8,000, the current number now, what is the number now, and maybe in terms of ixesha how singalindela uba singafumaneka nini ezibhedi, because I think they might be critical. And also, like in as far as Minister of Health, Dr. Mkhize's unhappiness about the data management in the province, have you made, or your team in the province, have sent a quick scan about abantu criticizing Ipondo on how it's handling this pandemic, and if mhlawumbe how are you responding? Because you said you don't want to be drawn into politics, but have you made a quick scan of abantu abakalazayo? And the other question, like, there are people about complaining, saying that the MEC is not doing umsebenzi ngendlela fanele ayenze, and that you are happy about the progress that the Department of Health in the province has made. But abo bangakho interested in politics, can you take them into confidence about izinto ohappy ngazo ngo-MEC in as far as the performance systems are concerned?
Okay, thank you. Amen.
Thanks for young opinion from SABC. Most of my questions have been covered by my esteemed colleagues. But since the province is unique in terms of its nature and character and focusing on the health facilities, wouldn't it be wise, looking at the stats and how we are dealing with these pandemic, to remain low level 5 as the province, or would that be exaggerating the matter?
Thank you.
Enkosi kakhulu, okokuqala laa mbuzo siyithatha ngoba intlonti la nto yenziwe yiHerald. The article of Herald was an extreme distortion of facts, a complete mischievous article by that journalist. The fact that the journalist continued to keep on making reference to sources, not what was happening in the meeting. So I think we also want to appeal to media not to play with emotions of our people. We are in a very critical time. We want responsible media to report responsible, taking into account that you are a platform that must communicate with our people what it's supposed. We're not saying that the media must not critique, must not do report, but as long as you understand that you must seek the facts, you must seek the truth from facts. It's important. Minister has never done what is being reported and what is being really attributed to him. Minister was answering an epidemiological question around the issues of stats and the reconciliation, and it has got nothing to do. It's unfortunate that the doctor who presented there made an indication of a latest casualty in this point, which was not even in the stats of the minister. As you understand that what we know today will be reported tomorrow in terms of what NICD is doing and how numbers are being reconciled. So that on its own was a very unfortunate situation, which of course went viral, and the minister was indicating on what could be done and how we should be improving on that. We actually ourselves have been raising the issue of the stats, how to deal with discrepancies. Because now as we're seated here, we are aware about people who now know that they are positive. But that stat is not going to appear in the today's stats that is going to be announced by the minister. Because our teams are on the ground, are informing people about the results, that your results are out. And those numbers will then be reconciled and they will come tomorrow, because we are a day, actually we've got a day lag in how we reconcile the stats. I think the doctors will be able to talk to that from NICD. So I don't think people must just play into this thing and try to blow things out of proportion unnecessarily. A reckless reporting is not necessary at this time. Our people are panicking out there, and our people are really trapped into this anxiety trepidation. So we really want to make that a special plea. Sisesenyeleni umcimbi uyawuzawuba shushu njengoba inyanga ziyaziqenqeleka ubheka phambili. No president utshilo ba sawumane sinyenyisa kodwa asinawuvula sibhuqe kuba ingxaki zizawuba nkulu njengoba sizawungena ebusika sibheke phambili nje ngokuya sinyenyisa kuzawuba ezi numbers sithetha ngazo. Currently we're talking about 2,000 beds esinazo that esisebenze ngazo thina kule nto sinayo. Ufosvagen kula field hospital asithembisa ngayo pha, it will take about 4,000 beds. We currently have the field hospital that has been done at Nelson Mandela Bay Stadium, which was handed over to Department of Health. We will be officially launching it soon. It has got everything. It has got bed. We will be looking at ventilators, nazo zonke ezinye the necessary apparatus that you need for that hospital to work. So we're working around those numbers. We are targeting to have about 500 beds per field hospital in almost every region, looking at how our province is so vast. Those are numbers that we are working on, and CIS that the inevitable is unavoidable in this case. Whether we like it or not, we knew. That's why as a province we started our campaign early enough, even when we had no case reported positive, because we knew what is happening in Gauteng, Johannesburg, what is happening in Western Cape is going to directly affect us. The repercussions of what is going on there is going to come to us. That's why we started to prepare ourselves. Yiyo lento namhlanje sisithi si-screene abantu aba almost 450,000. Ayingomdlalo lo, ngumsebenzi, because kune-plan eyelandelwayo every day. Kunabantu amathandazwe, ama-volunteer asebenzela urhulumente agqiba lonke iphondo ejikeleze senza lo msebenzi. Yiyo lento siyi-province siteste abantu abangu 80,000. You can go and compare us with other people as well. We are within that because we are working on a one plan, national plan that has been customized, that has been adapted to our material condition, and we are doing that. We are doing that, and we have been reporting to National on daily basis. We have never had a situation where National says, Eastern Cape, you are not working, we are not reporting. We are reporting. All the other things as interventions, zifunwe sithi uba njengoba ingadanika siqondi nje sasitshilo kwasekuqaleni national uba ezinto zenzeke eGauteng njengoba upresident echaza uba kuzaba kwi-lockdown, uluhlu nehlokondiba labantu elibaleke eGauteng lashiya iKapa leza apha la manani ebesiba nawo apha impela veki nempela veki esiza bephondweni siyazile into bazasixakekisa. Kodwa ke kuzo zonke ezi outbreaks zethu, Port St John's funeral, Zwide funeral, prison, ngapha Lady Frey Cacatu eBankis, ezo zonke sisebenzile ububheke emajola sihanqele yonke village. To date, more than 500 people base amajola have been tested. Out of that sifumene abantu bayi-40. Uba besingayenzanga loo nto ngesingayazi le 40 yonke lento yenzeka ngokokuba sisegroundini senza umsebenzi religiously and responding to our plan, and our plan is working. So that's the reason why I find it strange for some people just to wake up and call for premiers, for MEC's head. Gabantu nje abanga-understand uba kwenzeka ntoni. But it's going to be important that people start, we have really embarked on information dissemination, so that every day sinika abantu i-stats, eza stats azenzekeli senziwa ukuba senza umsebenzi egroundini, and we start giving people. So it's going to be important. Siyabacela abantu ahlukane nentlonti ngexesha lobunzima. Sisebunzimeni ngoku, abakwazi uthandaza mabathandaze, abakwazi usebenza basebenze, abakwazi ukwenza nantoni enokwenzeka mabenze loo nto, kuba idabi esikulo lidabi lokuhlangula ubomi babantu bakuthi. Siyabacela abantu bakuthi kangangoko abantu basemajola ngengithetha iteam yethu isegroundini, oomasipala, owe-district, owe-local besebenza no-public works no-health, sizama ukuqokelela abantu babekwe kwiindawo ezifanelekileyo, so they will be getting the latest xa siphuma apho uba kuhanjwe kwayomiwaphi. Kodwa sithe bonke, kodwa sithi okwazi ukuzigada nozigcina singathanda ukumgcina endaweni yakhe, kuba nala comfort yasekhaya iza kuncedisa kule nto yoba abantu bakwazi ukurecoverisha soon. I-advantage yale plan sisebenza ngayo yokokuba siyokhangela le ntsholongwane siyibhaqe kuse-early, izawusinika amathuba amahle okokuba abantu barecoverishe, kuba asibalindi bade bagule ayofika esibhedlele sithi xa simtesta sele enzakele esibhedlele sifumanise into yokokuba asisakwazi ukumnceda. Ngoku sibabhaqa kuse-early kuba siya all over the show. Nangapha kulalali yase eBankis senze loo nto sarhangqela ilali yonke, kuba naseBankis ibingumngcwabo kwakwizila. Zonke izinto sithi mazingenziwa, abantu bakuthi basenza funeka bayazi babancedisa lo mbulalazwe ugubungele abantu bakuthi, and abantu bakuthi baza kuphulukana nabantu baba babathandayo nemiphefumulo yezihlobo nezalamane ngenxa yokungakhathali nokungavi kwabantu abathile. Uyabona ke buwenza loo nto ufuna uzazibunga umbulali. Xa sisithi sukwenza umngcwabo ngexesha loba singenza imingcwabo, wena ufuna ukwenza loo nto, wenza itheko, wenza utywala noba ngumqombothi, sazi into yokokuba usecebeni lobulala abantu kuba ngoku abantu babulawa yilaa ngqokelela yenziwayo ngabantu bayohlala phaa. Abantu ezilalini ke umngcwabo yinto esentliziyweni, akuzange kabekho umntu othi xa enengxaki angahanjelwa abone. Siyabacela abantu ngokwalo mzuzu emfazweni akho joni libuza uba lingcwatyelwa phi. Yiyo le nto sisithi ngoku abantu mababe ready nokungcwaba eKapa ububhubhele eKapa, mababe ready nokungcwaba eRhawutini ububhubhele eRhawutini, mababe ready into yoba xa ufika apha uqhushekwe. Ifamily ngawenza umngcwabo nangelinye ixesha ikunike ilantsika isikhumbuzo, inkonzo yesikhumbuzo efanelekileyo. So masiyazi into yokokuba siguqule indlela yokwenza izinto kuba asithandi, imeko iyasinyanzelisa into yokokuba siguqule indlela yokwenza izinto. Siyayibona ke into yokokuba isikolo kufuneka siqhubeke sisenza kuba kuzawuba njalo kuba naba sithi besele befakwe esikolweni bafundiswe ngaba sibabona bayoyika naba bangamanesi njalo njalo. Kubikwe imbiba, kubikwe ubuso. So siyafuna ukulungisa kuloo nto, kodwa siyabacela abantu bakuthi bayazi into yoba akukho urhulumente unoze abe reckless ngozama ubulala bona. Masisebenzisaneni apho kukho khona izikhalo sizimamele ngokukhawuleza, siziqhoboshe, sizilungise izikhalo. Into ebalulekileyo uba urhulumente makaphendule, ephendula ngokukhawuleza xa kukho ingxaki ezivelayo. Yiyo loo nto ndithe ku-SG enye yeendlela zosebenza kwi-disaster ayiyo le ndlela iqhelekileyo ye-protocol ne-red tape karhulumente. U-SG makabe nendlela yosebenza direct no-CEO bezibhedlele, no-district directors. Kuba u-district director uyafumanisa uba xa esebenza funeka aripote ku-chief director, aripote ku-DDG, iyofika ku-SG. I-turnaround time yaloo nto iyingozi kwingxaki esikuyo because ingxaki esiyibona namhlanje funeka silale silungise namhlanje. So asizukwazi uqhubeka ngaloo ndlela. So uba kukho ingxaki esibhedleleni esithile makwenziwe loo nto, kodwa ndiyabubona ubuwokoko bukhona kwizibhedlele ezininzi oo-CEO ngendlela akumanejwa ngayo izibhedlele. So funa uqinisa ke naphaya because banamagunya abawanikiweyo okulawula nokulungiselela le meko. Siyidakancile indlela yokulungiselela le meko nokuqinisekisa into yokokuba kufuneka kwenziwe ntoni kuba silungiselela unongekehli. Mayithi senzeka sibe siyazi, singathi yakwenzeka sigcwala ithafu okanye iinkokheli zifake intloko esantini. Funeka sikwazi ukunika isikhokelo esicacileyo ngeli xesha ingxaki eyenza kulo. Sibethe isikolo, intsimbi yofaka isikolo, abanye babethe intsimbi yosikhupha ngaxeshanye. Siyayibona loo nto leyo, naleyo siyabanqanda ababenza loo nto uba sanukuyenza. Abanye basasaza izinto apha eziphikisana nento eyenziwayo, bathethe izinto ezingathethiyo, abanye bagrogrisa abantu, abanye benza zonke izinto. Abantu mabayenze bayazi baphula umthetho. Urhulumente ucacisile uba makwenziwe into, senza ke loo nto efuneka yenziwe ngurhulumente. Uba beningenaso esi stats sowuthesta abantu ayonto yalapha eBhisho okanye apha e-Eastern Cape. Ubuthetha ngabantu abathestiweyo ubanikwa ngu-NICD. Uba ndithi abantu base-Eastern Cape abayi-8,000 bathestiwe, ayingomanani aphekiweyo le aphekwa apha e-Eastern Cape, ngamanani u-NICD asinika wona because sitheste abantu. So ngokwangoku ii-indicators ze-performance ka-MEC ziza kuba senza ntoni, le program sinayo siyayilandela iyenzeka, and aba bantu sibaskrini bayi-450,000. Ingxaki esenayo nje lapha eBuffalo City nayo siyayilandela ngoba amanani ethu apha eBuffalo City asezantsi abantu abaskrinwayo. Nangona sinayo le ngxaki siyayibona ke nalapha kwi-system ibangelwa yintoni. Kwezinye ii-districts sina more than 100,000 yabantu asele beskriniwe, and we are able to close ezo areas zinjengezo. So yonke ke loo nto siyenza kuba kukho umsebenzi, and u-MEC ukhokela lo msebenzi. Akukho MEC yesibini apha. Yonke le nto ndithethe ngayo susela mhla saqala okokoko sisebenza ikhokelwa ngu-MEC esebenza nale team ka-national. Ayifikanga kwabhadakazi apha, ayifikanga kwanti nonti engekho, ifike unti ekhona. Kuyasetyenzwa apho, kukho umsebenzi owenziwayo, and ucacile uba sivuka senze ntoni, xa kutshona ilanga siripota ntoni. Akukho.
All right, so we're going to leave things there. That was the Premier of the Eastern Cape, Oscar Mabuyane, addressing the media on the efforts by his province in addressing the COVID-19 pandemic. He said that a lot of the provincial plan and interventions that are being coordinated with the national effort. He said that the plan had been widely welcomed and that so far good work has been done, led by the MEC for Health, Sindiswa Gomba. He talked about some of the challenges such as stigmatization that was coming through and sticking to things like self-isolation, particularly in the rural areas. He says that they'll be clamping down on these issues. But he said that his government was continuing to learn every day on how to better manage this war against COVID-19. Compliance is important despite the challenges, he said, that citizens are facing when it comes to things like funerals, cultural practices, and going out to buy food, just social distancing, again, things that people should be taking a look out for. He says that if we all look after each other, we don't need to be calling in the army to force compliance, that we should all be adult. He says let's all be adult in our approach to safety and dealing with this virus. He said that this week religious leaders, Labour and traditional leaders will be approached to make sure that we're all on the same page. He talked about a number of field hospitals that are being established because according to estimations they're going to need 8,000 beds to deal with the anticipated number of cases in the province. So far, he said that 8,000 people have been tested, more than 450,000 screened, and all of this being part, of course, of the plan in looking for the virus now as active detection. He says that he appreciates the donations that have been made by various people and organizations, but warned that people should not be exploited by these food parcels. He says that, in fact, the funerals are a big issue because we believe that there are around 200 COVID-19 cases linked to just 3 funerals in the process. It says that they're linked to, as I said, to just 2 funerals in the province. It's believed in Port Elizabeth, for example, 160 cases stemmed from 2 funerals. In Majola, Port St. John's, 40 new cases stemmed from 1 funeral. And the Premier said that if we had our way, we'd actually have banned funerals, but the national guidelines say that we must comply with allowing this to happen. The MEC for Health in the Eastern Cape, Sindiswa Gomba, then spoke and said that for the safety's sake, every funeral actually should be treated as if it's a COVID-19 death. And she also explained that hospital visits should be limited and prepared food should not be brought into these hospitals. So that was a briefing, as I said, led by the Eastern Cape Premier about the situation in the province. We'll have more on that and other issues relating to COVID-19 a little bit later on. Now, a 24-hour